Good evening, and thank you for joining us tonight for this engagement event. The value is going to be in the breadth and depth of the discussions in our breakout rooms, but I'd just like to take a few moments just to set the scene by addressing a few areas that may actually help those discussions. So I'm going to cover some of the questions that have been asked in previous listening events in a form of a summary, and give some of the background context informing the reform principles. More importantly, I'm going to start the conversation around the modified offer for the 2023-24 contract variation. Just before I move on, can I just highlight that we are taking questions in the Slido question box just below the screen. If there's anything that you would like to ask, please put that in there. We might not be covering all of those this evening, but we will be producing a fact sheet after these events, which we'll distribute to everybody. So please feel free to use the Slido function. So we've been asked a lot of questions in the past, and I'll just try and summarize those very quickly. The first is, why reform and why now? You'll probably be aware that the government has a series of commitments which has been put into legislation and various parliamentary acts within the programme for government. The main one for healthcare is A Healthier Wales, of which dentistry had a response to that when it came out in 2019. Within that, it's a very complex system, but I've tried to pull together 6 of the main areas which are within Healthier Wales that are directly relevant to dentistry moving forward. And you can see that one of those priorities was the reform of the primary care contract. And within that, we are looking at all of the different areas that are going to impact on how we can take a reform programme forward. And you'll be aware that we have all these very interlocking problems which we've got to try and find an amicable solution to try and give the best outcome both for the profession and for the patients. So we're asked a number of questions in the past around the whys, whats and wherefores of the contract reform. And as you can see on the right-hand side, this is based around the Wellbeing of Future Generations Act, which is looking at how we can both improve and maintain the health of the population of Wales for now and into the future. And within that is the Healthier Wales and our own specific oral and dental response. And more recently, we've just had the Professional Standards Authority release their document, which is looking at safer care and how they will be regulating the regulators going forward. And this will all impact on how we deliver dental services. So we were asked why reform, and I've tried to highlight some of the key areas and the reasons of what we're going to try and achieve through this reform programme. So the first is to try and give more freedom and responsibility to individual practices to look after their patient base. But in return, we'll be looking for that to be reported so that we can monitor the population health outcomes. Now, this is going to reduce our emphasis on looking at counting interventions, counting against a target, and that's all part of our commitment to move away from a UDA monitored activity towards an oral health review for all patients. And that is how we're going to start looking at the population changes within our patients' oral health. That will obviously impact on quality, which is part of the Healthier Wales objectives, and that is why we're using ACORN. And then we're going to be looking more at system reform, and I'll cover that in a second. But what we're wanting to do is to move forward with the contract reform, because that is one of the areas which we would like to address for you, so that practices have that stability, which we're hearing has been impacted because of COVID, because of changes. And without a change within the contract, it's going to be very difficult to continue with the reform programme. So we are going to run the two in parallel, but we're asking at the current time for you to concentrate on the changes that we're proposing within the contract reform. Now, you'll be aware that within the reform programme, this is a coordinated approach with GMS, optometry and pharmacy, as well as ourselves. And we have a very complicated governance structure, but we are working in the space on the bottom left, where we're looking at all the options that we can put into the proposal that will go into the primary care alignment group, and that's where we'll start to negotiate on what a new contract will look like. Now, in a number of the meetings, people have been asking how they can get involved. So we've added in a fourth work stream with professional engagement, which Russell Gidney is going to be leading for us. And that will allow the profession to feed in all of their comments into the reform programme. As part of the governance, we've also got an evaluation which Bangor University are going to undertake independent of this reform programme, so that we can ensure that we are covering all of the correct procedures. But it's important at this stage that we get all contributions, all suggestions, and we capture that so that we can put it into the mix. I underline that at the current time, we're not negotiating. We are collecting as much information. We are wanting to listen. We're wanting your comments, but we need that constructive feedback so that we can put it all into a proposal, which will go through the Dental Strategic Oversight Group, and that will then go into the Primary Care Alignment Group. So when we're in the breakout rooms tonight, it would be really helpful if you could raise an issue, but also to actually try and offer a solution or an alternative, because we're looking for things that we haven't heard so far. And in particular, just keep in mind that we're actually looking at contract reform, and also as part of that, the system reform. Because people are saying, what's the vision for system reform? Well, trying to capture it in a diagram is very difficult, but what we've tried to do on this infographic is just look at how dentistry works across primary, community and secondary care. All the coloured horizontal boxes are areas which we've heard we need to be working at. We need to be doing DCP development, looking at international recruitment through the PLVE process, looking at how the universities feed our supply chain, how we're working with urgent and unplanned care. And each of these areas are going to need a level of funding. So when we're talking about looking at a reform programme, within that we need to know what we need in each of these areas, how we're going to develop that, and more importantly, what resources and potentially what funding do we need. So as we move into our timeline, and that's another question, is what are we actually trying to achieve? And we've said right from the beginning, when I first started in April this year, that we would have tonight's event, that we would be then moving during the autumn period into a workforce and contract modelling, and that's going to be happening over the next 2 months, so that by December we'll be able to confirm with you what the 23-24 contract variation will look like. And that will include an amendment to the volume metrics, because we've heard that this is something that you'd like us to work on, and have further engagement events in January, so that we can then move into a period of negotiation as to what a final contract will look like. Once that negotiation has been completed, that is when the legal framework will have to start, because one of the problems we have at the current time is we are constrained by the legality around the UDAs, and therefore we need to have a secondary legislation change in order to be able to deliver that new contract. We're then going to maintain all the stakeholder events. We'll get Bangor University's final evaluation report in late September next year, and then we'll be in a position to start implementing a new contract in early 24, but we will then have to continue on with ongoing monitoring while we're actually looking at the system reform. So you're probably getting the idea this is a very incremental approach. We are taking it at a steady but persistent pace, because we don't want to rush something which is not fit for purpose. And we have to bear in mind that we've been trying to address contract reform since 1990 and 2006, and here we are 30 odd years later, still looking at what might be an ideal contract. And I think we're all realistic at this point that there is no such thing as an ideal contract, but we can make that contract the best for ourselves and for the patients. So I guess the bit that people are wanting to look at is what have we heard, what potentially are we suggesting that could be the changes for 23, 24. So on the left-hand side are the 22, 23 metrics that we're currently working with. And one of the main changes is around the new patient metric. We've heard that 5 new patients per 150k contract value has been extremely difficult to achieve. So we're proposing to drop that down to 2 patients for the 170k. In return, we would like to have 3 urgent access slots for patients not previously treated by the patient, and that is just for urgent care stabilization. That isn't for ongoing care unless you have the capability to take them on as a new patient. We're hoping, therefore, that will even out some of the problems of identifying new patients, particularly the very high needs new patients. And therefore, that is addressing some of those concerns, but we still need to have urgent access because that is our priority at the current time. I'm also going to just mention at this point that we've put the 170k contract value. There is going to be the DDRB uplift being announced very soon. We have no intention of altering the number of patients within whatever that 170k looks like with the DDRB uplift. It is still going to be 2 new patients for the 170k equivalent. We're not going to be increasing the number of patients. There are 2 other new elements which I appreciate will have administrative impact, but this is because we've been listening to some of your suggestions. The first is the BSA are asking for the NHS number to be recorded on the FP17W. They are able to do that for a large number of the forms, but there will be some patients where we'll be asking reception staff to fill it out. Once it's done. And that's all part and parcel of us looking at what potential registration may look like. And then the other, which I know will be contentious, is within the high trust environment that we have within contract reform, is asking for a self-declaration of how many NHS sessions you are doing, because that way we can then look at some of the requests for pensions for nurses, maternity leave, funded CPD, indemnity, lots of things that people have been asking, but we need to have the clarity of how many NHS sessions are we looking for. We are not asking for any details about people's private practice at all. It is just how many sessions are being provided to the NHS. So it looks like we've got more boxes, but as you notice, some have been removed and some have been no change, and some are going to have a short-term impact in terms of administration. But we're asking that as part of putting everything into the negotiated mix. And then finally, we have listened, and I know some people think that we could be listening more, but as the reform program progresses, we really want this to continue to be an iterative and collaborative process. So some of the things that you've said we are working on at the current time, for example, new patient treatment plans to be accepted onto Compass when opening a course of treatment, which should allow easier monitoring of activity levels and you to have more visibility in terms of the new patient metrics. We've heard a major impact around DNA rates, and we're looking at IT solutions that we can bring in to try and support practices, and we can discuss that in more detail later. I want to be transparent around clawback, and you'll hear from Peter in his recorded video about how the health boards are starting to try and get some consistency around this. I don't want clawback, you don't want clawback, because that's money that tends to be lost to dentistry. So we've got to find a way that we can actually deliver service and access to patients, but will reduce that risk of clawback. There will be times when there will need to be clawback, but what we've been saying all the way through is have early and conversations with the health board, and they will be able to give guidance and give you support on this. So we're still committed to try and remove clawback, but we need to have that conversation ongoing with the health boards. And then finally, we're hearing a lot that you'd like us to do more about communication. We've been doing things on social media and in the public arena, and there'll be a lot more as we go into the autumn. So I've spoken enough because I would like people to have the chance to discuss these points. But first, I'd like to introduce 2 short videos before we go into the breakout rooms. Our second will be Peter Greensmith, who will be talking about the year-end review. But before that, we're going to start with a video from Professor Paul Brocklehurst, who is going to discuss what the early data is telling us around the reform programme.